Hello and welcome to Lakeland Regional Health's Total Joint Replacement class. Whether you're having a total hip, knee, or shoulder, we welcome you, and we are glad to partner with Watson Clinic and Lakeland orthopedic surgeons in preparation for your surgery. On the left, you see a healthy joint. It has the smooth edges, the cartilage is all intact, there's plenty of synovial fluids in your joints. But as we age, as we have accidents, wear and tear, the cartilage begins to break down. As you see over on the right-hand side, some of you maybe have torn meniscus. You might be developing bone spurs. And despite conservative measures and private treatments, you are now ready for a total joint replacement. This class, along with the preoperative screening that your doctor will do, and preparation and education, are all keys to a postoperative success. The more somebody knows about a surgery that they are facing and what to expect, the better they will do. So we thank you for taking the time to watch this. We invite you to ask your family members or loved ones that are going to be helping to care for you to also watch this in anticipation of your surgery so that they can be better prepared for you once you arrive at home. Over the next few days or weeks, you will be expected by your surgeon to have labs drawn. You possibly could have a chest x-ray depending on how long it has been since your last one. And an EKG will be done to help the surgeon determine your medical clearance. Depending on what he finds or things that show up during these tests, you might have further workup with a cardiac doctor just to make sure that you're cleared both cardiac and medically before your surgery. You will also could possibly be invited to an outpatient appointment at a physical therapist, either at the Watson Clinic or Lakeland Orthopedics. And here they will evaluate you. They will ask you some questionnaires and evaluate your ability to exercise. And we just want to see where you are with your recovery strategy, what your goals are for rehab, and what is your plan for discharge home versus going to physical rehabilitation clinic. Any exercises that you do before surgery is considered prehab, and then after surgery is considered rehab. So we get down to the day before your surgery, and up to this point the doctor will have met with you probably again or have made a phone call to you and telling you when to stop certain medications. But the day before surgery, either your physician will give you antibacterial products to bathe with the day before surgery, or you will tell you which ones to buy at the store. But we want you to take 3 of these chlorhexidine showers at home the morning before your surgery, the night before your surgery, and the morning of your surgery. And this is just to help prepare your body to get it as clean as possible before surgery. Ladies, do not shave your legs for a few days before surgery, whether you're having a hip or a knee done. Any clipping of hair will be done at the hospital once you arrive the morning of surgery. So men don't need to do any kind of shave in your area. Any hair removal will be done by the nurses at the hospital. You will receive a phone call from the hospital the night or afternoon before your surgery, and this will be telling you the exact arrival time to the hospital. Your surgeon may have given you a different time than what this phone call tells you, but you need to go by what the phone call time tells you to arrive at the hospital, because that is the actual surgery schedule has been made, and that's what we're going by, not by what the surgeon thought a few days or weeks ago that your surgery time would be. They'll also tell you what to bring, when the last time you should eat or drink anything, and they'll remind you about your baths and any other instructions that you need. Remember, after midnight, usually the night before surgery, you're not allowed to eat or drink anything. The morning of your surgery, take whatever medications the physician told you to with just a tiny sip of water. Do not use any applesauce or anything to help you swallow any medications. You have to only use water, or the anesthesiologist may or not want to take you to surgery. We need you to bring the following things from home the day of surgery with you. You're going to need your identification card and any insurance cards, including your pharmacy card. Lakeland Regional is offering, with our partnership with Publix Pharmacy, a delivery to the orthopedic patients on M5, the discharge medications that you'll be going home with. So if you would like Publix to fill those and deliver them to your room prior to your discharge, then you will need to have on hand on the day of discharge either cash or credit card to pay for these. This is totally up to you. If you prefer to use your regular pharmacy, then that will be fine, and your prescriptions will be sent there. We also need you to bring a list of your medical conditions and any prior surgeries. So think about this over the next few days or weeks before surgery, what you've had done before. Even though you've told your surgeon, just have the list of that, because the nurses want to ask you these questions for our records at the hospital upon arrival. We also need a complete list of your medications And remember, any natural, over-the-counter medications need to be included here so that the doctor, the surgeon, can determine whether he wants you to continue these after surgery or not. We need to know the exact dosages of these medications, the frequency of when you take them, and the date and time the last dose was taken. We also need a list of allergies, and we'll go ahead and talk about the difference between allergies and side effects. An allergy is a true reaction to a medication where you stop breathing, horrible hives, or something like that. Many of the medications we give, especially with surgery, can have side effects such as nausea or itching, but they can be easily treated with other medications so that you can tolerate them. So we'll need to know any allergies so that we can document that. Your vaccinations, we will offer you the pneumonia and the flu vaccines while you're here at the hospital if it's in season. So you need to know if you've had pneumonia since you were 65, has it been more than 5 years? And if it has, we will offer that to you. And if it's the flu season, we will offer that to you as well. You can bring any toiletries just to make you feel comfortable, but the hospital does have generic brands of things if you did forget anything. If you want to bring your own pajamas and robe and gown, that's fine. Usually we wear the hospital gown for the first day or so until the IV comes out, and then you can wear your own clothes. We need you to bring non-skid-soled shoes for when you work out with physical therapy. These can be tennis shoes or something that has non-skid soles that are easy to put on and off. And then if you have sleep apnea and you use a CPAP machine, please bring that with you, including your distilled water. Because you're going to need that after surgery to help you breathe, especially with the sedation from anesthesia. The day of surgery, you're going to drive to entrance B. This is on the far north side of the hospital off of Parkview. You can park in either the garage or use the valet parking if you arrive after 7 a.m. You're going to check in through the main surgery waiting room. So walk on through lobby B, and on the right will be the main surgery waiting room, and then they will escort you back to your pre-op room on M2, which is ambulatory surgery area. Here, the RN will verify your medical history, your medication list, your allergies, your vaccinations, and review your orders with you before surgery. They will also do any prep work, which might include vital signs. They'll start your IV, any lab work that needs to be done on the last day, and of course the hair clipping. And then they will also give you another antibacterial wipe of the surgical site and your body. And this kind of is a product that stays on your skin, and it continues to kill bacteria for another 12 hours after it's applied. And this is one final antibacterial wash before you go back to surgery. We will also place TED hose on your feet. When you go back to holding, one person can go with you, but it's very limited room, so we can only have one person back there with you. Here, the anesthesiologist or the nurse anesthetist will come out and talk to you about any anesthesia history that you had before. So this is if you've had sleep apnea or any breathing problems, any dental issues, any allergies, or any severe reactions to anesthesia before, you're going to want to talk to him about that. The surgeon or his assistant will also come out, and they'll make sure that your surgery site has been marked. Many surgeons ask you to mark these sites ahead of time, but if that has not happened, then the doctor will make sure that the right leg or arm has been marked before surgery. Nurse will also come out, introduce themselves, and go over your surgery plan. Then you'll be taken back to the operating room. Your family or friends will be given an ID number so that they can track your surgery progress on the board in the waiting room. And the surgeon will come out after your surgery is completed and talk to any family or friends that are there and discuss with them how your surgery went. So we ask that if anybody is waiting for you, that they do not leave the waiting room until after the surgeon has talked to them. Once the surgeon has come out and talked to the family and friends that are waiting, then you can go take a break and go get some breakfast or dinner or something. But we ask if you leave, then that's invariably when the surgeon gets through with surgery and wants to talk to you, and he doesn't want to wait for family to come back. The patient will be taken to the recovery area, and here you will stay a full hour until you are stable. The family and friends will be informed of your transfer up to M5 after you have been completely recovered and your room is ready. We ask if any family gets to the room that has been assigned to you up on M5 before your arrival, that they be very careful, because we take the trapeze off the bed and we put it in the corner, and then that will be put onto the bed of the patient when they arrive. And so we don't want people tripping over that in the corner of the room. Also, when the patient arrives to the floor, there's a lot of things going on. So let's go through these. We take your vital signs very often for those first few hours after surgery, because this is the first indication if there's anything adverse going on. This includes your pulse, your blood pressure, respirations, your breathing, your oxygen saturation, and your temperature. And These will be done for the first 4 hours hourly, and then after that every 4 hours until you are discharged. You will also have IV fluids. These fluids are going through an IV in your arm or your hand, and this is not only for hydration, but it's also how you get your pain medicine for those first few hours. And we also give a preventative antibiotic right before we put you to sleep, and then after surgery, about 8 and 16 hours after surgery, you get 2 more doses. And this is just best practice. Nationwide, the orthopedic surgeons always give the same antibiotics preemptively before and after orthopedic total joint replacements. You could also be connected to an IV pump. This is just to help regulate your fluids, and that will come off the day after surgery once all the antibiotics and your pain medicine is finished, completed through the IV. We've talked about the trapeze that is set up on your bed once you're back in the room, and this is to help mobilize yourself around the bed and get you moving around a little bit better in the bed. We start off on a very minimal diet. We usually like just to start with ice chips until your stomach is settled. Many times anesthesia can cause some nausea, and if people eat too much too quickly, they can get nauseated and have some vomiting, and we don't want that. So we ask that you to start with ice chips. Once you can tolerate a clear liquid diet, then we'll advance you to a regular diet. But please start slowly. Don't try to eat a whole lot at any one meal, and just try to order soft foods. Your bandage, if you are having a hip, you will have a small bandage up along the incision line. Knees will have an ACE wrap from the thigh all the way down to their toes, and sometimes there is a knee immobilizer around the knee to help keep that knee straight for the first 24 hours. Many times the hip replacement will also have a large A-shaped pillow to help keep your legs apart, to keep them from crossing over. And shoulders will usually just have a small dressing with a sling and possibly a swath that's wrapped around your chest to help support in the shoulder area. These dressings are usually changed on the second postoperative day, and when you get discharged, we will give you supplies and instructions on what to do when you get discharged. Many times our drains will only be in the total knee replacements, and within the first few hours, any blood that is collected in these drains will be given back to you as a blood transfusion, and then it's discarded after that. These drains usually come out either the first or second day after surgery. Every physician manages their pain differently. There's multiple ways to control pain postoperatively. Some surgeons use a spinal or nerve block. So therefore, when you come back, you don't feel anything right away, but then it does wear off, and that pain can come on very quickly. So we will recommend, regardless of whether you're feeling any actual pain when you return after having a spinal or nerve blocks, that you go ahead and start taking pain medication, because when it does wear off, it can wear off quickly and it's not so comfortable. Other patients use PCA pumps, but not all of our doctors are using those, and we will discuss that here in a few minutes. We can also give you IV injections of pain medicine if you're not on the PCA pump, but our ultimate goal is for everybody to get over to oral medication as quickly as possible. Once you're able to tolerate regular food, then we'll try to get you to the oral pain medication, as this does seem to have better pain control. Please communicate your pain to your nursing staff so that they can help work with you on keeping your pain at a comfortable as possible level. Regarding the PCA pumps, or the patient-controlled analgesia, you have, as the patient, control over the amount and the timing of your pain medicine. Not every surgeon is using these anymore, but it's connected upon return to the room after surgery, and it's only used for the day of and the night after surgery, and then we stop that and move you over to the oral pain meds. Only the patient should push the button for the PCA pump. We don't want family members pushing the button, because if the patient is not awake and alert enough to push it, then we don't want him to get overly sedated. We also connect anybody that uses the PCA pump to the capnography machine, which measures your CO2 levels and your respirations, and this helps keep you from getting overly sedated. So it's just another precaution that we use with the PCA pumps. We ask that everybody communicate their level of pain using a number scale of 0 to 10, 0 being absolutely no pain and 10 being the most severe excruciating pain you can imagine. It's normal to have some discomfort after surgery, so anywhere between the 1 to 2 to 3 is a normal, but if you get beyond 3 or 4, we ask that you ask for your pain medication. Generally, the IV injections can be about every 2 to 3 hours, and the oral pain pills can be given about every 4 hours. But you're going to need to ask for those, because we don't give any pain meds automatically. Anesthesia and pain medicine can have some side effects. These can include itching. If you have any itching, please let the nurses know. Many times just a dose of Benadryl here and there can help control the itching. If it is becoming severe or you're getting a rash, so we may need to consider changing either your pain medicine or antibiotics. That could be the culprit for the itching. But please communicate any itching that you have so that we can treat that. Nausea and vomiting can occasionally be an issue also, and we have medications that we can give after surgery for that. Generally, if you just lie really still or sit still with a cool cloth on your head or forehead or neck, then that can help it pass. Nausea sometimes just kind of comes over you in a wave, and then it can pass over you. Generally, we don't need to treat it, but if we do, let the nursing staff know. Sleepiness or lethargy is a normal side effect from anesthesia and pain medicine, but we want you to be arousable enough so that when we call your name or we say something that you are awake easily. If it becomes that you're very, very sleepy and hard to arouse, we might have to give you some reversal medication. And postoperative delirium is a very real thing. If you refer to your total joint book, there is a page about that. And the nursing staff can also give you some information about that. It's usually in our older patients population whose kidney function is not working as well, so the medications tend to accumulate in their body. Usually this passes after a day or two with hydration and backing off on the narcotic pain medicine. Amnesia is also a very normal thing. It's normal to forget things after surgery, and taking narcotics. That's why we recommend that you don't sign any legal papers while you're taking narcotics or immediately after anesthesia. And another complication can be constipation. This can occur anytime you have anesthesia or narcotics. The nurses will give you stool softeners and or laxatives every day after surgery to help you have a bowel movement. But we ask that you start taking some over-the-counter Colace or Biscadil 100 milligrams a few days before your surgery. And this will just help to soften your stools. We're not saying a laxative, just that stool softener can help soften your stools before you come in so that then when you do start taking the pain medicine and the narcotics, you don't get constipated. This blue breathing machine is called the incentive spirometer. We will give you one of these before surgery and teach you how to use it. This helps take those deep breaths and stimulate a cough so that you can clear your lungs after surgery. If you do not cough and clear, things can settle down and can cause pneumonia. So we want you to take 10 good slow deep breaths with this device every 5 to 10 times an hour while you're awake. And then after you take those nice good deep breaths, we want you to purposefully cough up any secretions and spit them out. Don't swallow those because that can cause nausea. We use these two devices for cold therapy. Cold helps to prevent pain, and it also helps with swelling. If you have a total knee, your physician may use this cryocuff that's on the left. It's a portable cooling system that runs cold water through that tube and around the knee. It kind of bathes the knee in nice cold water. And you'll use these for the first few days after surgery for any swelling. You can take it home. It is disposable. And it does not last forever. So sometimes patients are calling weeks or later, months later, saying, my ice machine isn't working anymore. But it is disposable, but it should last sufficiently for the first few days or weeks after surgery to help the swelling of your knee. Other patients that are especially the hips and the shoulders will just use the old-fashioned ice bag that you see on the right. Blood clots are a complication that can happen after any surgery, particularly a total joint replacement. It's also been called deep vein thrombosis or DVTs. And it happens whenever the blood slows down. When this blood slows, it wants to coagulate or clot. And when these clots break off, they can travel to the lung is usually the first place it goes, and it can be a pulmonary embolism or a PE. These can form very quickly, they can be difficult to detect, and they can be fatal if not treated quickly. So we have multiple ways that we prevent these things from happening. The first way is mechanical, and it's using these TED hose or the tight stretchy white hose that go up to your knee. If you have a knee replacement, we will use the foot pumps that you see in the middle. And then if you're having the shoulder or the hip surgery, you usually have the wraps that go around your calves. And these last two devices put pressure on the deep veins in your feet and legs to help stimulate the blood flow. We also expect you to move your feet around as much as possible when you're lying in the bed or sitting up in the chair. And of course, early ambulation and mobility are the primary ways to prevent a blood clot. So the sooner we can get you up and moving, the better. And then we also prevent blood clots with pharmaceutical or medications, and they're anticoagulants that we use to thin your blood. This can be in the form of a shot and or a pill, and you will take these for several weeks after surgery. Every physician has a different regime that they use, and they will discuss what their plans are for anticoagulants with you before surgery. The pharmacist and the social worker will help you arrange for these after surgery to get them started on you when you get discharged. A physical therapist will come to your room every day. If you arrive to the room early in the day on the day of surgery, you may have a round of physical therapy that afternoon or evening, but definitely the day after surgery we will begin therapy on you, and you will have it usually once or twice a day while in the hospital. Try to stay on top of your pain medicines prior to these physical therapy sessions, but we expect you to therapy yourself. Getting up and out of bed, getting to the chair, ambulating around the room, going to the bathroom, all those things, even with the nursing staff, is still considered therapy. Some physicians use this CPM, or continuous passive motion machine, for the total knee replacements, and it's to help exercise your knee. We put you in there, your leg in there 3 times a day for 2 hours at increments at a time, and we increase the flexion of that knee about 5 degrees each time. So the more you can be in here to help stretch your leg out, the better, and then also with physical therapy. Hand washing is the #1 way we can prevent an infection, so we expect everybody that enters your room, family, friends, and of course all healthcare providers, to wash their hands before they touch you. They should always wash their hands when they enter or exit the room using either the hand sanitizers that you see in the white devices or soap and water at the sink. But we definitely want everybody touching your bandage or your incision to be washing their hands and wearing gloves, and then of course before and after they do any personal hygiene on you. Things to look for as far as an infection in your incision. This is usually not going to happen for after 48 or 72 hours after surgery, but any redness, swelling, drainage, wound separation, increased pain, or a fever over 100.4. Please let your surgeon know if you notice any of these things, but just keeping your incision clean and dry and away from any pets is the best way to prevent an infection. We also ask that you shower. Once you get discharged, your physician will let you know when you can begin showering and changing your dressing at home. Because you are having surgery and anesthesia and pain medication, you're having to use a walker due to your altered gait. You're going to have an IV and possibly drains, and those foot pumps for the first few days after surgery. All these things put you at risk for falling. So we ask that you call for help before you get up. Please call before you fall. Do not get up by yourself. We ask that you wait for the staff to help you, and to please use your walker every time. Our staff also will be using a gait belt that they put around your waist to help prevent you from falling, and it gives them something to hang on to as you walk with therapy and with the nursing staff. We have 2 social workers on the floor that will assist you in making your discharge planning. They will either arrive and talk to you the day of surgery, but definitely the day after surgery. And we have several options for going home with physical therapy at home, or going to a skilled nursing facility. The expectation is for many patients that can, most physicians prefer that you go home, but we need you to have somebody that can be with you for those first few weeks to help you get in and out of bed, back and forth to the bathroom, meal preparation, kind of a fetch and carry type of person. If you do not have someone that's able and willing to help you, then we suggest that you go to a skilled nursing facility for a short-term course of a few days or a week or 2 of physical therapy at a rehab facility. And the social worker can give you the list. There's also a list in the booklet that we will give you of facilities that are in our area. And then ultimately we want everybody to be going to an outpatient physical therapy clinic for those last few weeks before their final discharge and their final clearance from their physician. If you need medical equipment at home, the social worker will be glad to help you arrange for these things. Usually a walker is needed by everybody that has a total hip or knee replacement. We want the front folding walker, no wheels. If you have one from a previous surgery or someone's loaning you one, we ask that you have someone bring it in while you're here at the hospital. It doesn't have to be the day of surgery, but before you go home, so they can make sure it's at the right height and measurement. Our physical therapist can work with that prior to your discharge. If you do not have one or do not have access to a walker, our social worker will arrange for that for you. And then the bedside commode, or the 3-in-1 commode, if needed, to give you elevation of your toilet at home. It also helps provide support with handrails that are on the sides of it for comfort getting up and down from the commode. These will also be arranged with the social worker before discharge. After you go home, or whether you go to a skilled facility, the ultimate goal is to begin physical therapy at an outpatient clinic, and these will be helping you get your final weeks of rehabilitation before you're cleared by the surgeon for your full return to life with your new joint. Thank you for watching. If you have any questions, please contact the M5 manager or the social worker and physical therapist on the floor.